This week, I have had a similar conversation with a couple patients that are chronic low back pain patients, along with a few of our baseball players. One of the major components that we see with chronic low back pain and/or with development of throwing athletes is the ability to have very strong glutes and putting in the work to build very strong glutes. One of the best exercises for that is the barbell hip thrust or a version of doing a hip thrust. With squats, that breaks our body down a lot more than being able to do heavy hip thrusts and then turn around and do that potentially later that week itself. The conversation we had this week was an important one in the sense that these athletes all voiced that when they tried to do hip thrusts, they felt them more in their low back here as opposed to in their glutes. So we went through a few options, and of course, this information could be different per person. So that's why it's important to work with a professional that can help figure out exactly where these details might work for you. But I figured I would share some of these tips because it really helped a few of our patients, and you never know if it could help for you. So number one is our setup before we actually bring the weight up. We'll go through that option. The patients I worked with this week for this, we were doing the setup for them to be able to do it at home. They have kids and they need to be able to rep these out in their own environment. And then we're also going to talk about the fact that you want your low back to be comfortable. It doesn't need to be the thing straining or contracting when you're doing that hip thrust motion. So the position will be that our low back, what can happen when we feel it in the back as opposed to the glutes is that there's this almost like, it can be a small amount of the low back arching a little bit, and then we try to raise the hips up. What you want to do is be able to tuck your pelvis under. I'll tell some people it's like a dog that's in trouble and they tuck their tail under, but you want that motion to feel really nice. If you're not sure where that motion is at, then you can do kind of standing pelvic tilts to figure out, okay, this angle, my back doesn't feel like it's working super hard. Okay, next, we're going to go through the setup itself. So when you do this inside of a gym or even in your home, you want to pick a surface that you can comfortably place at your back at about the level of just below your shoulder blades. So I'm just using my office chair for this example. If I come down here and I'm going to place the chair itself fits right at that spot for me specifically. Let's say I have a barbell that I'm going to be rolling up my legs. So the barbell's under, my legs are underneath the barbell. I'm going to roll that towards me. And I'm going to place the barbell kind of above my hip crease if I can get it there. When we have a barbell that has a lot of weight, obviously you have to kind of figure that out for your setup. But if you roll it up here, then the second you bring it up, the bar ends up right where you want it. The next step, once that barbell sits up here, and you might have to really like tuck it under, is to physically pull your legs close to your butt. In other words, I'm going to reach over, pull my legs up, and I physically pull my legs up. It's totally fine to do that. The closer our heels are to our butt when we do that hip thrust motion, the more likely we are to use our glutes as opposed to our hamstrings. If your legs are further out and then you bring the weight up and then you have to try to adjust your feet back, that can really, really aggravate. Like those tiny movements could be an aggravating factor for someone with low back pain. So from here, if I have that barbell, imagine it sitting across here, I pull my legs up close to me, comfortable distance apart from my feet. From here, I'm going to put my arms up against whatever surface I'm on. Now I'm kind of like a teeter-totter where I'm going to keep my trunk steady and just bring my hips up. So that action. Notice I did that actual kind of tilt under. Then I'm going to grab the bar. From here, just my hips go down. I push through my heels, squeeze my glutes to come straight up. What we sometimes see with someone who has that habit of kind of arching in their back is when they come up, they'll arch a little bit here and then try to drive up. So this angle you want to be cautious of. If you feel it in your spine, the adjustment is to tuck under. So we went through the setup itself. foot placement so that you can utilize your glutes the best possible way, where to place the bar, and then how to actually get that bar up for you to perform the hip thrust itself. There are different types of hip thrusts, so that's kind of a different section or scenario for what we're learning today. But if you suffer from low back pain, especially chronic low back pain, but you want to be able to start incorporating some strength training into your glute training, then try these tips out. Let us know how they work for you. We had a lot of success with that this week and wanted to share.